Welcome. Thank you for joining our educational webinar, Flu and COVID-19, Preparing for Safer and Healthier Holidays with Dr. Michael Stevens. Today, we're here to talk about how to protect you and your family from flu and coronavirus. This is especially timely with the holidays just around the corner. We know that you and your families have questions. I know that my family does. Um, One note, we will be saving our questions for the end of our presentation. We will have a Q&A at the end. At any time, you can put your comments in the chat, but at the end of our presentation, we will have that Q&A. So just that note that we will hold on questions. To introduce myself, my name is Nina Fryer, and I'm Strategy and Marketing Manager for VCU Health, and I'm honored to be introducing our speaker, Dr. Michael Stevens. Dr. Stevens is Associate Chair for the Division of Infectious Diseases. He pursued his undergraduate education at the College of Charleston, attended medical school here at Virginia Commonwealth University, specializing in internal medicine, infectious diseases, and hospital epidemiology. Dr. Stevens currently leads our antimicrobial stewardship program, our travel and tropical medicine clinic, and he is the interim hospital epidemiologist for us here at VCU Medical Center. He also conducts research on infection prevention and antimicrobial stewardship, and as interim hospital epidemiologist, he frequently represents our healthcare system in the media. Thank you, Dr. Stevens, for joining us today. I will now turn the show over to you.
Yeah, thank you so much, Nina. I'm excited to be a part of this and to present this information. I'm excited for the Q&A as well, and we can dive in. So we're going to talk about flu and COVID-19 and some prep for the holidays. And let's get to it. So flu season's here. We're in it. There's not a lot of flu activity nationally yet, and no one knows really where that's going to go. Just to recap, in 2020, there was very little flu activity in the United States. Usually, there's a lot of flu activity. There's a fairly high number of deaths from flu, but in 2020, we really didn't see much flu at all. However, we still saw around 700 deaths from flu. So flu is a deadly illness. It's a terrible disease to get. If you get it, you'll never want to get it again. Right now, we don't know where this flu season is going to go. So it's possible that we see another flu season like last season because people are still sort of trying to stay away from each other, at least in some communities and some parts of the country. People are wearing masks. Will that decrease flu? Or have we lost some of our population immunity because we had a relatively mild season last year? And will we have a bad flu season? That's possible too. So we don't know. And so the bottom line is the best thing to do is to get vaccinated. And we'll talk more about that. So next slide, please. Yeah, so this is it. So the bottom line is we can't really predict what's going to happen with this flu season. So getting the flu shot is your best way of preventing getting the flu and then transmitting that on to somebody else. And so it is important to note that the flu shot actually is not on average as good as the COVID vaccines that we have. So the COVID vaccines are remarkable in terms of their effectiveness. The flu shot can be anywhere between 50, 60%, sometimes a little bit higher, good at preventing flu sort of straight up. Now, what's really very good about the vaccine, the flu vaccine, is that it prevents severe illness. And so that helps you. And so if you get the flu shot, even if you develop flu, maybe you don't have low oxygen, maybe you're not sick enough to be in the hospital, or you don't spread it to somebody else. So that's good. It is important to note that flu and COVID can look very similar. And so you're not going to necessarily know what you have. And every time you develop those upper respiratory symptoms, cough, shortness of breath, your runny nose, you're not going to know, and you're going to have to quarantine, isolate, and then seek care and get tested. So the bottom line on the flu shot is you should get it. You should get it now. You can get it anytime. There's still not a lot of activity nationally, but we're seeing some cases here and there. So now's the time to do it. Because remember, once you get the injection, it'll take a couple weeks for you to build that immunity that the vaccine is going to give you. And so it's going to help you reduce serious illness. The flu shot, there's lots of experience with this. People are very familiar with this. It's a very safe vaccine. Because flu shifts year to year, we have to actually change the vaccine year to year in slightly different ways. And in fact, most of the vaccines that are available actually have 4 different types of flu. They protect you against 4 different types of influenza, and so that's important to note. And it's going to provide robust protection for months. And so I would go and do that for sure. Next slide, please. So we talked about this already. Bottom line is the vaccine, the flu vaccine, isn't necessarily 100% effective at preventing flu, but it is very effective at helping to prevent severe illness, which is definitely a reason to get vaccinated. And it will prevent a lot of flu cases. And so if you've ever had influenza, you never want to get it again. Usually the people who get flu are the folks that are first in line to get that flu shot. Next slide, please. Where are we now with COVID? So fortunately, we're seeing some positive indicators that COVID activity is declining, both nationally and in the state. Now, it's way too early to get excited about that and to relent some of these aggressive infection prevention measures we have in place. We still have a huge amount of COVID activity in the community. We're still listed as having high activity in the way that the CDC defines this. And so there's a lot of COVID out there. It's just that we're doing better than a couple of weeks ago, where there was just an enormous amount of COVID out there, really the second highest amount that we've had throughout the entire pandemic the last 19 months. And so we still have a lot of high activity. And importantly, as we look to the next month and a half, 2 months, 3 months, well, we have to worry about a winter surge. And we saw that last year. And basically, when we look at the total population of Virginia that's vaccinated, let's just look at that. It's about 62% of the state is vaccinated of all people in the state. There's a lot of people who have not had COVID and don't have any kind of natural immunity. There's a lot of people who are unvaccinated. And the coronavirus is very infectious. This Delta variant, which really has taken over, is 2 times more infectious than the original strain. And there's a lot of people who are very that are very susceptible to infection, and it's going to sort of burn through the population that's unvaccinated or has no immunity. And so we're going to see a lot more COVID, and we're going to see a lot more spikes unless we get more people vaccinated. I bring this up because we are probably going to see another surge. Maybe we see another winter surge, because in the winter, just like we see increases in flu activity, well, a lot of that has to do with the fact that there's a lot of people indoors in the winter, and it's a much more favorable environment for the virus to spread. And so still a lot of activity. We do all have to think, well, what's going to happen over the next 6 to 8 weeks as things get cold? Are we going to see another surge? So we're not out of the woods yet. Next slide, please. So the COVID vaccine, the absolute best thing you can do right now. In my top 5 things you can do right now, the top 4 are get COVID vaccinated. If you're not vaccinated against COVID, you should do that right away. This should be your top priority. This is going to protect you from getting severely ill. This is going to protect the people around you, because you won't spread the coronavirus to them. And this is really how we're going to get out of this as a community, as a society. That we don't want to see these periodic surges where really society in part shuts down. There's enormous pressure in schools and on the healthcare system. We all have to do our part and get vaccinated. But it's the very best thing you can do as an individual, and the best thing you can do for your family. I also will say, if you're eligible for a booster, and we'll talk more about that, you should get the booster if and when you're eligible for that. Next slide, please. So let's talk about the boosters. Right now, the Pfizer vaccine is available as a booster under a couple different settings. So the first one is if you have an immunocompromising condition, and it has to be pretty profound, like you had an organ transplant on profound immunosuppressing medications. You are on other medications for different reasons. You have a cancer and you're on chemotherapy. Then you would be eligible to get really what's a third dose in the primary, Pfizer series. So that Pfizer series is 2 shots. 28 days later, you get a third shot. So that's one population of folks that are eligible to get a vaccine booster now. Now, the other group is a much bigger group. They can get a booster 6 months after they received their primary series of Pfizer. So if you're in one of these groups and you're 6 months after receiving the first 2 shots of Pfizer, the Pfizer coronavirus vaccine, you can get a booster now, and that may help the vaccine work longer. Right now, we know that the vaccines that we have are all still incredibly effective at preventing severe illness and death, but they lose a little bit of their punch over time in terms of just preventing coronavirus outright. And that's this idea behind the boosters. And so what age groups are we looking at? So the age groups we're looking at, next slide, please. Yep, the age groups we're looking at is 65 years and older. So if you're 65 and older, you're eligible to get that third booster, that third dose, that booster dose of the Pfizer vaccine right now. You can do that right now if you're 6 months out of the primary series. If you're 18 to 64 and have a medical condition that puts you at higher risk for severe disease, and this really can be almost anything. You can find a list of different conditions online, but it can be high blood pressure. It can be some sort of chronic heart or lung disease. It can be many different things. You are going to be eligible for a booster. And then the last group are folks that are at higher risk because of occupation or where they live. So if you're a teacher, if you work in healthcare, if you are a resident in a long-term care facility, those sorts of things, you'd be eligible. So there's many, many, many people who are eligible for that booster dose. Now, on the prior slide, and we don't have to go back, the big question is, well, hey, I got Moderna, or hey, I got the Johnson & Johnson vaccine. When am I going to find out about boosters? Well, the good news is the FDA's committee that looks at this met last week, and they were agreeable with giving a Johnson & Johnson booster, and they were also agreeable with a Moderna booster. Now, the next step is this goes before a vaccine committee of the CDC, which is meeting this week. They'll discuss it. They'll give their recommendation to the director of the CDC, and we could see answers on the Moderna and Johnson & Johnson boosters even within a week. So hang tight, watch the news. If you got Moderna or Johnson & Johnson, you likely will have an answer to this question of boosters in the very near future. And certainly if you have questions on this, let's talk about it in the Q&A, and I can let you know where I think this is going. Next slide, please. So again, flu and COVID-19 look very similar. And there's a lot of other viruses floating around out there right now. As we've seen kids go back to school, people are around each other again. Some of these viruses where people haven't had a cold in a year and a half, now are getting these colds again. The problem is you're not going to be able to tell the difference of upper respiratory infection, cough, sneezing, runny nose, maybe some shortness of breath, maybe a low-grade fever. That could be COVID. That could be influenza or flu. That could be RSV. That could be the common cold or rhinovirus. We're seeing, really very high activities in some of these other viruses like rhinovirus and earlier in the year RSV, because again, people are around each other again. And so the bottom line is if you develop symptoms, you should isolate, even if you're vaccinated, because we're seeing some breakthrough infections, and you should get tested. And right now you should get tested for COVID. As the activity goes up in the community, you're likely need to get tested for flu too. Some of the tests that they send actually look for flu and COVID together, but you should isolate and you should get tested, because remember, you may spread COVID to somebody else who's either not vaccinated or couldn't make an immune response because they're they either have cancer and they're on chemotherapy, or they have some other condition that prevents them from making an immune response. So you're helping those folks, you're protecting those folks, and you're also protecting the group that can't get vaccinated yet. And so people less than 12 years of age, kids, they can't get vaccinated yet. Now, hopefully in the near future, we're going to have vaccine available for 5 to 11-year-olds, maybe even in the next month. So more to come on that. But there's still going to be kids less than 5 that can't be vaccinated. So we have to do what we can to protect others. And so, isolate, get tested. That's the right thing to do right now. You could potentially get multiple viral infections at the same time. You could get COVID and flu together. It's possible. The bottom line is you're not going to know. And so you should isolate and get tested. Next slide, please. So what about the vaccine? So I'm saying get COVID vaccinated. I'm saying get influenza vaccinated. Can you get these things at the same time? And the answer is yes. You can get them on the same day. Your body will have no problem handling those two things and learning to make an immune response. So if you encounter these things, that you're going to be protected, or you have protection from the vaccines. You can get them on the same day. You can get them a day away from each other. It doesn't matter. It'll be fine to get them at any time interval relative to each other. And I suggest you just do whatever you can to get vaccinated for both as soon as you can. Next slide, please. So, all right, let's talk about holidays. And so this is a hot topic for sure. I've got two young kids, and I'm brainstorming Halloween, thinking towards Thanksgiving and other holidays. So this is definitely something we're all thinking about. And so CDC has actually produced some updated information as recently as October 15th about what we should be doing for the holidays. And so for Halloween, they say that children can go trick-or-treating outside. They note that it's better if they go in small groups. They note that people should avoid large crowds, and if they're around a lot of people, probably wear masks. Certainly when you're indoors right now, you should be masking. If you're not at your own home, and if you're around others that don't live in your house, and watch for updated advice in this space. Bottom line is this: you can get infected with coronavirus outdoors. There have been multiple examples of outbreaks that have happened. It's a very infectious, transmissible virus. You're a much higher risk if you're indoors in a crowded, poorly ventilated space. That's a great place for the virus to transmit. But outdoors, if you're within 6 feet of each other, you can definitely get infected too. So the bottom line, while we're seeing high community transmission, you should wear a mask when you're outdoors if you're near people and can't social distance. Just like kids at school, if they're going in a small group, if they're wearing masks, they're going to be safer. And that's sort of the bottom line. So if your kids aren't going to reliably stay 6 feet apart from each other, you kind of want to handle it like you would handle it with them being in school, which is, mask up outdoors. And that's the safest thing to do. And then certainly everybody who, when you're not at home around immediate family and you're indoors, should be masking right now, even if you're vaccinated. Because again, we've seen some breakthrough infections in vaccinated people. I will say one thing about breakthrough infection. So we don't know how frequently this happens, 1 to 5% maybe. Usually the people who are vaccinated just have mild illness, like a mild head cold. Remember, if you weren't vaccinated, you could have severe illness. You could be in the hospital with low oxygen. You could be on a breathing machine. So the vaccine definitely benefits you. But remember, if you've got a breakthrough infection, you can still transmit it to somebody else who can get severely ill. And so that's an important thing to keep in mind. Next slide, please. So if we go forward to Thanksgiving, we don't know exactly what the recommendations ultimately will be around this, but they likely will look like last year. So if we look at last year, what did we have to do? Well, there's there's recommendations to limit in-person celebrations, wear a mask if you are around folks and somebody could be immune compromised or unvaccinated. It was recommended they get vaccinated. It was recommended to host events outside when you could, as opposed to inside, and washing your hands was recommended. The most recent advice from the CDC, and it's not clear that we'll see updated advice before Thanksgiving or not, was to do really all these things, but they put a higher emphasis on vaccination. And in fact, they say, get vaccinated. If you're vaccinated, that's the best thing you can do to protect yourself and others. They even say you should consider avoiding travel, or they say avoid travel if you're unvaccinated or you're traveling with people who can't get vaccinated, like small children. And they mentioned a number of different things on their website, which you can go to easily, sort of Google it and find it, of ways that you can actually travel in a safer way, but they note that nothing is 100% safe, especially if you haven't reduced your risk by getting vaccinated. And so they're really playing it very conservative, which again is probably the right call, because we look at it right now, there's still really high community spread. Everyone's aware that it's gotten cold. Well, it's going to get colder, and we may see another spike like we saw last year. And so that's what's recommended. So I don't want to say that because I don't like this any better than anybody else that's probably listening right now. But I think this year's holidays are going to look kind of similar to last year's holidays. Now, I will say the CDC breaks things down by whether you're vaccinated or unvaccinated. If you're unvaccinated, they recommend that you get a COVID test before you travel, 1 to 3 days before you travel. They recommend that when you return from travel, that you get tested at days 3 to 5 post-travel, and that you quarantine for a full week, regardless of the test results. And so these are things to keep in mind if you're unvaccinated and you're planning on traveling for the holidays. Next slide, please. And so really, some of these things are a moving target. I don't imagine that things are going to get a lot easier in terms of the infection prevention recommendations, in terms of the CDC sort of walking back any of the recommendations they're currently making. I can imagine things would get more conservative, meaning more sort of advice to stay clear of folks, masking, that kind of thing, if we see more spikes in coronavirus activity. But again, the thing that's going to get us closer to normal is getting vaccinated. And then right now, masking, if you can't really social distance or you're around people who didn't get vaccinated or couldn't respond to vaccination. So what I would strongly encourage you to do is to watch for updated advice from trusted sites like the CDC, like the Virginia Department of Health, because some of these things will shift as the pandemic shifts. Next slide, please. And I think we're at the Q&A. So Nina, I'll put it back to you.
I can chime in. A big thanks for that informative presentation, Dr. Stevens. And for folks watching on Facebook Live, YouTube, on vcuhealth.org, we're now going to open the floor to any questions you have. Before we get to those, I do want to share some questions that were submitted to us, before this event by folks. The very first is, last year, Dr. Stevens, we saw a decrease in the spread of flu. The flu. The question is, why was that, and will we see that trend again this year?
So Nina, thank you for that question, for sure. Yeah, so last year we saw very little flu. I mean, it was amazing how little flu we saw, and that was all about social distancing. People were not going into crowded indoor environments unmasked, wearing masks, and those sorts of things. And we had some low-level population immunity. We had some influenza vaccination as well. All those things led to really probably the best flu season we've seen in decades, if not longer. And so really the question is, and I brought this up earlier, and I'll recap. Will we see a bad flu season because we've lost some population immunity? And now you can look at, a sports event. You see 30,000 people around each other without masks. That's going to be a situation where people are going to spread coronavirus. And that wasn't happening a year ago. So we may see a terrible flu season, or we may see, little to no flu. We just don't know. So the bottom line is get vaccinated. It's the best you can do to protect yourself and the people around you.
That sounds good. I'll be sure to get my flu shot this year. In terms of our next question, the question is essentially folks going to the pharmacy, getting those boosters. Can they get those COVID-19 shots and the flu vaccine at one time?
Thank you, Nina. Absolutely, they can. So I would recommend that there's many places that you can walk in and you can get your boosters and your flu shot. If you can get them both, just get them both. Just get it done with. Your body will know what to do with them. The best thing you can do is to get them, both as soon as you can. If you had to prioritize one or the other, I would say get the coronavirus vaccine now, because there's a lot of coronavirus activity out there. But yes, you can get them on the same day.
Perfect. That sounds good. The next question folks sent to us is, Is it safe to get together with family members you don't live with? Would you suggest wearing a mask?
So this is a little bit tricky. So it's a little bit nuanced. So, if you're all vaccinated and no one has symptoms and no one's sort of at risk because they're immune compromised, then, you could probably be around each other indoors just in that small group. And you could probably meet and be unmasked. But I think the problem is you don't necessarily know all of those things, right?
Mhm.
Certainly, before you have symptoms, there's a short period of time that you could transmit coronavirus. And so I think the bottom line is this. If you don't know, if you're not confident, if have people who are elderly and frail and maybe, they can't respond to vaccination quite as well or really immune compromised or unvaccinated, like you have young children in the house, it's probably safer to mask and to sort of minimize exposing each other to coronavirus because they could get it. And that's sort of where we are. There's just so much activity in the community. You're safer just assuming that the people you're encountering have coronavirus right now.
Perfect. Thank you. And the last question that folks submitted before the presentation is essentially, flu and COVID-19 symptoms seem similar. Just how do I tell the difference?
Yeah, so Nina, what I would say is there's a lot of emphasis early on loss of taste and smell as being sort of what differentiates COVID and all this kind of thing. The bottom line is that's not the case, especially with Delta. There's been a shift in the symptoms a little bit, so that really you can have any respiratory symptoms or runny nose, cough, sore throat. Any of these things could be coronavirus. You have to default to its coronavirus and isolating and getting tested. And flu is going to look similar. And the problem is these other viruses that, before you just said, I had a cold, right? We can test and sort of put a name to those viruses. You usually don't have that happen. But those are circulating wildly and widely in the community right now, especially that rhinovirus, which is also known as sort of the common cold. And so you don't know. The bottom line is you have to isolate and get tested. And eventually, hopefully, we'll be out of that scenario. But right now, that's where we are, and we're going to be there for the immediate future.
Thanks, Dr. Stevens. It sounds like if I have the flu or coronavirus, either way, stay home, get tested, and figure that out. And being on our marketing team, I can plug our urgent clinic, vcuhealth.org/telehealth. We do have options for folks who don't want to go out and who do want to speak to a provider. Questions from the group, questions from folks joining us live. The very first is, are the booster shots the same strength as the doses you received during the initial Pfizer series?
So that's a great question. And so for Pfizer, the answer is yes. The answer is yes, it's the same dose. Now, for Moderna, we don't know yet, so don't quote me, okay? I know this is live and being recorded, but don't quote me yet. But the Moderna, it looks like it's going to be a half dose. The
Oh,
good news, though, is it's going to be drawn from the same vial. So it's not like they're going to have to manufacture a bunch of new types of vaccines. It should be pretty widely available, once they make a decision around that. So
awesome. It sounds like Pfizer, the same dose, Moderna, Johnson & Johnson, more to learn, but they could be different.
yeah, and the Johnson and Johnson probably would be the same dose as well. The same
Okay.
dose, the original, dose. So it's a great question.
Lots of booster shot questions. The next question is, can you walk us through where Moderna and J&J booster approvals are in the process?
For sure. And it's a little complicated when you watch the news trying to figure out, well, what does it mean? The FDA said this, but then there's more of a process. And so the bottom line is this. The FDA, the Food and Drug Administration, and the CDC, the Centers for Disease Control, are the big players in this process. And both of those organizations have vaccine committees that have to weigh in. They're committees that look at huge amounts of data to make these decisions around, are we going to allow for boosters, for the different vaccines? And so first up was the FDA's vaccine committee. They met last week and they weighed in. They reviewed the evidence for Moderna and then for Johnson and Johnson. And then also they reviewed a little bit of evidence for can you do discordant booster combinations? Like you get Johnson and Johnson, and then can you get like Pfizer or Moderna? So they looked at some of those data, and they seemed okay with Moderna getting a booster 6 months after the primary series. They also seemed okay with Johnson and Johnson getting a booster at 2 to 6 months after you get that first Johnson and Johnson vaccine. And they were sort of lukewarm on this whole discordant booster thing. So next up this week, the vaccine committee of the CDC meets, and they'll talk at least about Moderna, probably about Johnson and Johnson, and that recommendation then goes to the CDC director, who has the final say. And so you can expect that they're going to, once that committee meets, reviews the data, you can imagine they're going to get the information to the director, who's going to probably make a determination relatively quickly. That's where we are. A little convoluted, but designed for safety. And we can imagine even within a week, even within a couple of days, maybe we're going to hear about Moderna and Johnson & Johnson.
So it sounds like more to come with Moderna and Johnson, but answers just around the corner.
Yeah, we're closer now than we've been ever. And I know a lot of people have been waiting patiently, particularly with the Johnson & Johnson vaccine. So I'm really excited to hear the results of that vaccine committee's review.
I'm sure a lot of people are. Everyone's on the edge of their seats. Our next question from the chat: does the booster have the same brand or type as your original COVID-19 shot? So does the booster have to be the same brand or type as your original COVID-19 shot?
So the best thing to do is to follow the recommendations that are put out in terms of what to get for the boosters. And so in general, for sure, for what's been actually given emergency use authorization from the FDA for Pfizer boosters, the answer is yes. You should finish it with the Pfizer booster. And so we'll just have to wait to see what they say about Moderna and Johnson & Johnson. I think Moderna will probably be Moderna. And then Johnson & Johnson, the real question is, will it be Johnson & Johnson, or will it be a dose of, the Pfizer or the Moderna? We just don't know that yet. And so sort of wait and watch. I would strongly recommend people do what ultimately the FDA and the CDC are recommending, because remember, we know we have more data on these vaccines than any other vaccines in modern history. I mean, we have literally hundreds of millions of doses given. They're incredibly safe, incredibly effective. But what we have to learn is, how long will we maintain the immunity that the vaccines give us? Because we just, aren't far enough into the pandemic now to know that, right? Or into the reality that COVID, is a virus that we have to contend with. And so, a year from now, maybe we don't need any more vaccines. We don't know, right? We have to sort of wait to see if we're going to have decreasing immunity over time after, these boosters. If you do something that the FDA and the CDC are not recommending, you're not really going to know, with that next set of recommendations, what to do. It just gets more confusing for you to know, are you going to be protected or not? So I think the best thing to do, the safest thing to do, is to sort of follow what's being recommended.
Thank you, Dr. Stephens. I think that's a good recommendation, to follow what's being recommended. Our next question is, when can someone who recovered from COVID-19 receive the COVID-19 and flu vaccine?
This is great question. Yeah. So the bottom line is, if you're out of quarantine, you can get vaccinated. And so you're just keep in mind that with the Pfizer and the Moderna vaccines in particular, people are aware that it's boosting your body's immune response, right? And so, especially after that second dose, some people have low-grade flu-like symptoms. They don't have low-grade fever, don't feel 100%. It's a phenomenon where you just have to watch for it. It's your body making an immune response. If you've been previously infected with COVID, that first dose, you're going to have a response like that, because it's like you were already vaccinated. Now, what I will say is, you should still finish the vaccine series, but you can get the vaccine as soon as you're out of quarantine. As soon as you're out of quarantine, as soon as your symptoms are improved, and you don't have a fever, then you can get it. And the flu vaccine too.
So when you're feeling better, when you're out of quarantine, that's when to get vaccinated. When
Right,
you're feeling
exactly right.
sick, stay home, focus on getting better. We do have another question. The question is, how does COVID-19 spread differently than the flu?
Ooh, it's a great question. Yeah, so it spreads similarly in that it's droplet spread, meaning, you let's say you have it, you're infected with it. You've probably seen these videos online where you see the stop action of people, droplets coming out, and just all these huge number of droplets that people excrete when they sneeze. They do it within around 6 feet of sneezing, and they drop to the ground. But if you're in that environment and you inhale it, that's how you can get it. And flu and COVID are similar that way. Now, what I will say is different is, there's some background immunity to flu, a little bit, a little bit. It shifts every year, so you're not going to be really fully protected based on whatever immunity you have, but there's some background immunity, so it's not as infectious. Now, the coronavirus is really infectious, and so let's say you're in a population that has no immunity whatsoever. There's no vaccination in that population. No one's been infected. One person with this Delta variant may go on to infect 6 people on average. And you just imagine, if you had 100 people, you're going to infect everybody very rapidly. And so the flu isn't nearly that infectious. Maybe one infects two, depends on, the year and that kind of stuff. And so that's what's different. It's just more transmissible because we have a population that has no immune memory to it. It's a new virus. And so that's what's different.
So it sounds like both will be spreading this holiday season potentially, but coronavirus much more transmissible. But to protect yourself, get your flu shot, get your COVID-19 vaccine. Is that what I'm hearing?
Yeah, that's right. And what I would say is, flu may be more transmissible this year because, we've lost a little bit of that population immunity. So we don't know. And the bottom line is the best thing you can do is to get vaccinated for both. I would say the highest risk, if you had to put them side by side right now, for sure is COVID, because COVID is just so widespread right now.
And also, I mean, those vaccines just offer such great level of protection too, which is is terrific. That's the silver lining, right?
Well, the coronavirus vaccines are remarkable. I think at the beginning of the pandemic, if you said we would have two vaccines, the Moderna and the Pfizer, that are 94% effective at preventing, illness at all, and then incredibly, almost completely effective, at least if you're, have a normal immune system and early on, against severe illness and hospitalization and death. I mean, no one would have believed you, because that's an amazing feat of science to get those vaccines so effective. And so that's right. I mean, it's amazing how good these vaccines are. And so I think, really everyone should avail themselves of that so that they don't get really sick or get somebody else really sick.
Yeah, that sounds good. One more question in the chat. Why are there still negative effects even after getting vaccinated with the COVID-19 vaccine for some? I think this is about side effects. Why do folks have those side effects?
From the vaccines?
Yes.
Yeah, and so yeah, I run. I think you mentioned this, Nina. I run the travel clinic, and I give a lot of vaccines. I give a lot of vaccines for sure, and I tell everybody, for most of the vaccines, you can get the low-grade flu-like syndrome when you get one of these vaccines, because your body is making an immune response to them. So low-grade fever, maybe you don't feel 100% for a day. That's sort of normal and natural as your body produces, these it responds to the vaccine, so that if you encounter the disease in nature, that you'll know how to deal with it already, and so you'll be protected against it. And that's not uncommon with vaccines for sure. um, I will say that, the next question people usually ask is, well, if I don't have those symptoms, does it mean it's not working? No, not at all. Not at all. But you can anticipate it with the mRNA vaccines in particular, that Moderna and Pfizer. It's just really an indication your body is having an immune response.
A big thanks to everyone, on Facebook Live, on YouTube, on vcuhealth.org for submitting those questions. We are at the end of our program, and Dr. Stevens, it was just such a pleasure having you join us for this discussion. I'm glad we were able to discuss those precautions and also to talk about how we can celebrate this holiday season and how we can reduce risk. So just to reiterate for folks at home, the flu season is upon us. Make sure to get your flu shot. And if you haven't been vaccinated against COVID-19, please consider getting that vaccine. For more information, you can always learn more at vcuhealth.org, and you can follow us at VCU Health on Facebook. Once again, thank you, Dr. Stevens, and all who joined us today. Have a great night.
Thanks, Nina.
Thanks.